Well, I am so excited to be here today with Dr. Beahm of HCA Midwest Health, and we are talking about something that I feel like has been all over social media, in our doctor's offices, just a little bit more awareness of breast density and what that means for women. So let's just start with laying a foundation. What exactly is breast density, and how common is it for women to have dense breasts?
All right. Hi. Thanks for having me here. So, breast density is just means how much of your breasts are made up of fatty elements versus dense breast tissue elements. So, the breast is actually an organ, and it's an organ made for nursing. And so, it's made up of the lobules where milk is stored, the ducts that milk flows through, and then it's made up of these fibrous elements that hold things together. And the rest of it is made up of fat. And
Okay.
so we have when we talk about the fibroglandular elements of breast tissue, that's what we're talking about when we're talking about density. And then there's that component along with the fatty component. And the proportion that those things take up in your breast help to determine the density. So when we talk about density, we really divide it into four categories. There used to be more of a number associated with those categories. Now there's just these letters and these descriptions. So density A is what we call mostly fatty breasts. It doesn't sound very fun, but that's actually where, if we could all prefer to be
Right.
somewhere, that's where we'd want to be. And so mostly fatty breasts are made up of and this is talking about when we look at those breasts on a mammogram.
Right.
So one of the things that a lot of people think is that you can tell something about breast density based on how breasts feel on an exam, like based on how you think your breasts feel or how your breasts look or how your provider thinks they feel. So you
Hmm.
can have really, really lumpy, firm breasts that are mostly fatty, and you can have really dense breasts that are really dense. Okay, so this is based on a mammogram. So what a mammogram is a black and white picture of the breast, and the fibroglandular elements look white, and the fatty tissue looks black. And so when the radiologist is reading the mammogram, they're looking to see what proportion of each you have. So for
Okay.
density A or fatty breasts, it's saying that these breasts have less than 25% of the fibroglandular elements. So most of what they're seeing is black on the mammogram.
Okay.
The density B is what we call scattered density. And scattered density is somewhere between maybe 25 to 50% percentage of those dense elements, and the rest is fatty tissue. When we have density C, which is where honestly most people who are, 30s, 40s, 50s sit, that is 50 to 75% of fibroglandular tissue, and extremely dense or density D is greater than 75% of fibroglandular tissue. And so that breast density is a category that we find out on mammogram.
Okay.
And then you had a second part to that question.
How common is it for women
Oh,
to
how
have
common?
dense breasts?
Yeah, so about 10% of women have fatty breasts, and this is all comers.
Okay.
40% have category B or that scatter density, 40% have C or the what I usually call medium density, and about another 10% have density D or the most dense breasts. Now, when we get into a population of women who are more in their 40s, it's more like at least 44% of women have category C breasts, and maybe like 13% of women have category D breasts. So that breast density gets less as we get older, as our breast changes.
Okay. So we'd move from like
More
C
dense.
toward A as we get older.
That's
Okay.
right. Yes.
Okay. Okay. So why does this matter, especially when we're talking about women who are having screening and mammograms?
Yeah, it matters because the mammogram is a black and white picture of the breast. And usually, when breast cancers or abnormalities pop up on the mammogram, those things show up as white. Okay. So, what we're trying to do is we're trying to see something more white in a field of white. And so, if you've got mostly fatty breasts, if you see something new or something kind of pops up in on this mammogram picture, it's going to be really easy to see. Whereas if you have really dense breasts and your breasts are extremely dense, where sometimes you look at it and it's just this big snowstorm of white, you're trying to find something, discrete within that. Especially for mammograms, we're looking at little incremental change, and when it's
Mhm.
so hard to look through that breast tissue, then it's really hard to see that change. The other component of that is that breast cancers develop in that fibroglandular tissue. And so, if you have relatively less fibroglandular tissue in your breast compared to someone else, you have really a less likely risk of developing a breast cancer. Whereas if you've got a breast that is very dense, you've got more tissue there that could change into a breast cancer at some point.
Okay. Okay, Dr. Bame, if a woman is told she has dense breasts, what are her options for screening beyond just the standard mammogram?
Okay. So for dense breasts, the first thing to really think about is there anything else in your history that might put you into a different category, that might put you into a high risk category? So anybody who has density D breasts, I do recommend some type of supplemental screening.
Okay.
So if you have anybody who has any family history of breast cancer in either like a mom, a sister, an aunt, a cousin, along with density D breasts, is most likely going to fall into a high risk category, which is a score that we calculate based on your density and your family history and when you have babies and periods and those things. And that's called a Tyrer-Cuzick score. And if that Tyrer-Cuzick score is over 20%, then you're someone who insurance will cover MRIs in addition to your mammograms. And so then we recommend doing that flip flopping at 6 month intervals. So those are patients that I'm usually recommending an MRI once a year and a mammogram once a year, but we're flip flopping those screenings. But let's say you come to me and you're density D, but you don't have any other risk factors. You didn't have a late first pregnancy or a really early period or any of those things or any family history. Then most of the time, what we're recommending is supplemental ultrasound imaging.
Okay.
And then really you could do that any time of the year. I really like that alternating 6 month model though, so that you're getting some kind of screening to your breast, every 6 months, so that we can just see through that better. So, and we're talking about a bilateral whole breast ultrasound, not just an ultrasound that you go, if they see something, an ultrasound where their intent is to look through the entirety of the breast tissue on both sides to make sure that they don't see anything else that's hidden. Um, the other option, let's say someone didn't have a family history and wouldn't meet insurance criteria for an MRI, but they really, really wanted to be, as much in charge of what they were seeing as possible.
Mm-hmm.
Um, then there are options. A couple of different places offer abbreviated MRIs, which is not the full MRI screening, but it's an MRI that they do without all the images, but it's enough that they'd be able to see it. It's a good test for screening. So you
Okay.
could see something there if it were there. And that's something that people would usually just pay out of pocket for. So just a flat for fee. And again, a couple of facilities offer those through the Kansas City area, but it doesn't go through insurance. And so then it doesn't matter if you meet the insurance criteria for an MRI, which again would almost always have to be someone with at least a relative with family history.